Choline in eggs, aging, and heart health. What every senior and family must know. Introduction. Why this knowledge can save lives. Dear friends, before we begin, I would like to share that the understanding presented today is aligned with guidance and research from leading medical and scientific organizations, including the American Heart Association, the American College of Physicians, the American Academy of Family Physicians, and the European Society of Cardiology. These organizations emphasize that in older adults, health targets, including cardiovascular risk factors, should be individualized, carefully balancing long-term protection with risks such as dizziness, falls, frailty, kidney strain, and reduced quality of life. This means today's discussion is not based on opinion, but on modern, evidence-based clinical wisdom, combined with a human-centered and awareness-based approach to senior health. Today I want to share something that is rarely discussed, even among doctors, health professionals, and wellness educators. It is something that most of us, including myself, were never taught properly. We live in a time when heart disease, stroke, and cardiovascular problems are killing more people than ever before. Almost every family has been touched by heart attack, stroke, high blood pressure, blocked arteries, sudden cardiac death. At the same time, social media and YouTube are full of advice telling people to eat more protein, eat more eggs, eat 4, 6, even 10 eggs a day for health. These messages are often given with good intention, but they are usually aimed at young people, athletes, or short-term fitness goals. What is not discussed enough is this. The aging body processes food very differently. The aging gut is different. The aging kidneys are different. The aging heart and blood vessels are more vulnerable. So advice that may be safe for a 25-year-old may be very different for a 60, 70, or 80-year-old. What I will share today is not to create fear. It is to create awareness. This knowledge is important because many people eat eggs daily with good intention. Many seniors are told eggs are very healthy for all. Very few people are told about choline, gut bacteria, and TMAO. Even many doctors are not fully aware of this emerging area. By understanding this, families and seniors can make wiser, safer, more individualized choices that may help protect the heart, protect the brain, protect blood vessels, prevent long-term silent damage. This is knowledge that can truly help save lives over time. 1. Eggs and choline, the hidden part of the story. Eggs are rich in a nutrient called choline. Choline is important for brain and memory, nerve function, cell membranes, liver fat metabolism. So choline itself is not bad. It is an essential nutrient. One egg yolk contains a high amount of choline. But here is the part most people are not told. 2. Choline, gut bacteria, TMAO, the key pathway. In many people, especially with aging, choline is processed by gut bacteria into a gas called TMA, trimethylamine. The liver then converts TMA into TMAO, trimethylamine N-oxide. This is not theory. This pathway is well described in major medical journals. Why TMAO matters. Higher blood levels of TMAO have been associated in many large studies with increased plaque buildup in arteries, higher risk of heart attack, higher risk of stroke, increased blood clot tendency, worsening heart failure, higher overall cardiovascular mortality. This research comes from major cardiovascular centers, including Cleveland Clinic, and journals like Circulation and Journal of Clinical Investigation. 3. Why age makes this more important. This is where elders are different. With aging, Gut microbiome composition changes. Kidneys clear TMAO less efficiently. Inflammation increases. Blood vessels become more fragile. Metabolic flexibility decreases. So, a young, healthy athlete may tolerate high egg intake. An older adult with BP, diabetes, kidney strain, or heart disease may not. This is why one-size-fits-all advice is dangerous. Saying, everyone should eat many eggs daily ignores age, gut health, kidney function, cardiovascular vulnerability. 4. Main share from the case of the crime. 4. Why many people, even doctors, are unaware. This area of medicine is still evolving. Medical education traditionally focused on cholesterol, saturated fat, calories, protein. The gut microbiome plus TMAO pathway is a newer field. Many busy clinicians do not routinely measure TMAO, are not taught much about gut-derived metabolites. Focus on immediate lab values, not long-term microbial effects. So even well-meaning doctors may say, eggs are fine for everyone. This is not because they are careless. It is because this science is newer and not yet widely applied in daily practice. Foe. What the research really says. Balanced view. Science does not say, eggs are poison. Everyone must avoid eggs. Science does say, TMAO levels are associated with higher cardiovascular risk, especially in elderly and people with kidney disease, diabetes, and heart disease. Choline from foods like egg yolks can contribute to TMAO in some people. The response is highly individual. Age and kidney function strongly influence risk. Large reviews and meta-analyses in elderly populations show that higher TMAO levels predict higher mortality and cardiovascular events in older adults and high-risk groups. Cleveland Clinic and other major centers show the choline TMAO pathway is linked to heart failure, atherosclerosis, and vascular disease. 6. Why society needs this awareness. Heart disease is increasing. People are living longer, but with more chronic disease. Many seniors eat eggs daily with love for their health, but love without information can sometimes cause harm. This knowledge empowers people to ask better questions, individualize diet, protect long-term heart health, avoid silent vascular damage. This is not anti-egg. This is pro-wisdom. 7. Practical, safe public guidance for seniors. For many seniors, a safer approach is, for many older adults, 2 to 4 eggs per week. Not daily for everyone. More plant proteins. More fish, omega-3. Monitor cholesterol, BP, kidney function. Higher risk seniors, diabetes, CVD, CKD. Be more cautious with egg yolks. Discuss with doctor. Focus more on plant-based proteins. Conclusion. Empowerment, not fear. Dear friends, this talk is not about blaming eggs. It is about respecting the intelligence of the aging body. What was once harmless can become stressful for aging systems. What was once easily cleared can accumulate silently. True health is not just about eating more protein. True health is about individualization, awareness, long-term protection, listening to the body, respecting how aging changes biology. When seniors and families understand this, they gain power. Power to protect the heart, protect the brain, protect blood vessels, reduce silent risk, live longer with better quality of life. This is not about fear. This is about informed compassion for the aging body. Knowledge is not just information. Knowledge is protection. Knowledge is love in action. Important disclaimer. This lecture is for educational and awareness purposes only. It is not medical or nutritional advice. Individual responses to eggs, choline, and protein sources vary based on age, gut microbiome, kidney function, metabolic health, medications, and cardiovascular status. Always consult a qualified healthcare professional before making major dietary changes. The speaker is not responsible for medical decisions made based on this content. Thank you. Holistic Wellness Foundation. Imphal. Healing Beyond Boundaries. Selected key medical references. 1. Tang and Hazen, Journal of Clinical Investigation. Gut Microbiota, Choline, TMAO, and Cardiovascular Disease. 2. Cleveland Clinic, Circulation, Heart Failure, 2024. Choline TMAO pathway associated with heart failure risk. 3. Systematic Review, Cardiorenal Medicine, 2023-2024. Higher TMAO linked with increased cardiovascular events and mortality in elderly.